So we all are familiar with CPAPs and the medical side of sleep treatment, but for the millions of people that have been diagnosed with sleep apnea and they can't wear the Darth Vader mask, the big CPAP, and they can't handle that, there's an avenue in dentistry where we can help people. So let's talk about, she's not only into sleep dentistry, but she's like into sleep in general. So she gave me a podcast, which I want to talk about as well, the Joe Rogan Podcast, which was amazing. It blew me away about sleep.
He did a podcast with someone who wrote a book. He's a sleep researcher. His name's Matthew Walker. And it's a 2-hour podcast. It's really long, but I mean, maybe I was just geeking out, but I found it
it was amazing for me.
So many things, like so many just little things that you pick up, like so many little nuances that like we've all heard through our whole lives, like having a nightcap helps you sleep. It's actually the opposite. Drinking alcohol 2 to 3 hours before bed makes you sleep worse. Using marijuana to sleep actually destroys all of your REM sleep. Like, yes, you think you're sleeping. Any sleep aids, like Ambien, Lunesta, like you are getting your mind erased, like it's an amnesic thing where you think you took a nap, you think you went to bed, but you actually didn't. I mean, we've all heard these news stories of someone driving their car or making a sandwich or doing something silly while they're taking some of those drugs. Like, It's not actually making you sleep, it's making you think that you're sleeping, and then you're still suffering from the effects of sleep loss, which are many and numerous. I mean,
one of the things that I learned too, it just blew me away. I kept texting her because it's a 2-hour podcast, and I kept seeing all this stuff. So everybody thinks it's like, certain people say like, oh, I don't need a lot of sleep. I'm one of those people that can get by in 4 or 5 hours of sleep. And Joe Rogan was saying how it's like this badge of honor, like, I only sleep 4 hours. I only get 5 hours of sleep. Like it's this idea, like kind of like Gary Vee, like this hustle.
Being, super macho, or like saying that you don't actually need what Mother Nature has like spent billions of years creating.
And also said human beings are the only species that intentionally deprives themselves of sleep.
Yeah,
so what they said is if you get less than 7 hours, consistently less than 7 hours, for a man, your testosterone will be that of 10 years senior.
Yeah.
So, and it's funny because all the medical professionals in their 4 years of medical training or 5 years of medical training, the average amount of time that a medical doctor gets on sleep training is 2 hours. Yeah. So how many hours of sleep training have you had up to this point?
Over 100.
Right. Yeah. So a medical doctor goes through his whole entire programming with our whole entire.
Yeah, and we're talking about general doctors. Like there are medical doctors that only specialize in sleep. It's a separate, delineation. Most of the time they're ENT doctors because there are certain things that you can do as far as changing, your nose and things like that to help with airflow. But none of it actually, besides the CPAP, actually treats sleep apnea. Here, we're lucky because we see the patient as a whole. We get to look at their whole dental health. We can say that we definitely have a device that works, that can help with their sleep apnea. And we're finding with most of our patients that they're super happy, they're having relief of their symptoms,
their lives are better. I mean, there's not too many things that we can do in dentistry. I mean, obviously we can take you out of pain, we can do Invisalign to correct your bite and your smile, but as far as like quality of life things that we can do, sleep apnea is probably the single thing that we can make people feel the best.
Getting a restful night's sleep definitely improves your quality of life. And, it also lessens your chance of having a heart attack and a stroke and all these other bad things that come along with not having your battery recharged at night. Think about how long your cell phone's going to last if you only get like a 10% or 15% charge at night. The next day you're not going to have it for as long, but your body, can compensate for a certain period of time on reduced sleep. But like you said, when you have even 3 nights of less than 7 hours of sleep, just your ability to have full reflexes is compromised. Your ability to stay awake is compromised.
You're more dangerous than being intoxicated.
Correct,
too.
Yes,
driving a car or working in an environment like this, having less sleep, you're actually dangerous. You're likely to make an error.
Exactly.
And it's really just not talked about. So, and again, I don't want to paint with a broad brushstroke, but there's a lot of medical professionals that if you go, they'll just give you drugs.
Sure.
And they'll give you a sleep aid, and it's.
I mean, the reality is that physicians should be prescribing sleep, like not pills to sleep, actual just sleep, right? And that would improve a lot of things.
And there's a whole bunch of things that help you sleep better. Like in that podcast, they talked about how extreme darkness, you have to be dark, and this whole idea that we go.
Training your body. Right?
When we're meant to go to bed like right around sunset and wake up right around sunrise, but most of us are delaying the time that we go to bed, but we'll still wake up with our circadian rhythm when the light comes up.
I mean, that's true. I mean, there's tons of things you can do. I mean, majority of these things people already know, right? If you're a mother and you have children, you know all about putting your baby on a schedule. And that's basically what you have to do for yourself. You have to put yourself on a schedule. So
I need to do
you're
that.
right. Like there are certain hormones that are released, mainly melatonin, which is kind of like the start of the race, right? Melatonin has nothing to do with making you sleep. It just signals to your brain that it's time to sleep. So it's kind of like if we're running like a sprint, right? So you have the firing gun, that's melatonin, and it tells your brain, hey, okay, get ready for bed. But there's things like you said, you need to be in a room where you have decreased light. So before you go to bed, you need to make sure whatever room you're in that like the lights are dim, right?
And also, let's talk about the iPhone. Tell them a study about the iPhone.
Well, the blue light interferes with something called, really long word, suprachiasmatic nucleus, or the SCN.
Say that one more time.
No, we're not.
No, just I want to hear it.
It's called the suprachiasmatic nucleus. This is a part in
Yeah,
your
my
brain.
suprachiasmatic nucleus has been feeling very off.
Yeah, well,
because I'm on the iPhone a lot.
Right. So anyway, if you haven't done it already, there's a filter on your iPhone that after a certain period of time, it's called the sunset mode, I think, that you can switch it so it filters out the blue light and your screen turns orange. Really great, because that blue light or that blue wavelength interferes with your body knowing, is it morning or night? So if you're laying in your bed at 10 o'clock at night when you're supposed to be trying to go to sleep and you're looking at an iPhone screen that's fully lit, your body or your brain thinks, wow, it's morning, like let's wake up. But other things, so like screen
And by the way,
time
it says that screen time, 1 hour of screen time
delays
before,
by 6.
yeah, 3 hours, I think
3
they said.
hours, yeah.
So it delays your onset of sleep by 3 hours. So if you're like me, I get like a natural decrease and I get tired, like when I put the kids to bed, and I get on my iPhone, check my email or go on Facebook or whatever, and I get this second wind.
Right.
It's not a good second wind, it's a stimulated
No,
second
but
wind. And
that's part of like learning how to put yourself on
Sleep
a
hygiene.
schedule. Exactly, sleep hygiene. And taking a hot shower, because in order to fall into a deep sleep, your body temperature needs to drop by a couple of degrees. So, adding all of these things in addition to treating a condition if you have it that's medically necessary to treat will help sleeping. But if you don't have a sleep-related breathing disorder, just having good sleep hygiene can help you get a more restful night's sleep.